Bismillahirrahmanirrahim. The next topic of our discussion is Hirschprung disease. So Hirschprung disease is characterized by aganglionic segment of the colon, which results in loss of peristalsis and ultimately leads to accumulation of gastrointestinal contents in the colon, causing intestinal obstruction. Aganglionic segment means absence of ganglion and neural plexus in the wall of colon. There are two types of neuronal plexus. The first is the Meissner's plexus and the other is Auerbach's plexus. Meissner's plexus controls gastrointestinal secretions and blood flow, whereas the Auerbach's plexus controls peristalsis. In Hirschprung disease, there is absence of both Meissner's and Auerbach's plexus, which results in the formation of an aganglionic segment which does not exhibit any peristalsis. So the segment remains constricted. Almost 10% of the cases of Hirschprung disease are associated with Down syndrome, whereas 5% are associated with other severe neurological abnormalities. Males are more commonly affected than the females, but disease in females is more extensive than the males. So normally what happens is that during the embryonic development, the enteric neuronal plexus develops from neural crust cells. These neural crust cells migrate during the development and form Meissner's as well as Auerbach's plexus. In case of Hirschprung disease, there is a failure of migration of the neural crust cells from anywhere between cecum to rectum. So in this case, there is a formation of aganglionic segment of the colon anywhere between cecum to rectum. This happens due to two reasons. The first is that the neural crust cells prematurely stop migration, and the second is that there is premature ganglionic cell death. In either case, there is a lack of ganglion in a segment of the colon, resulting in formation of an aganglionic segment of colon, which means there is absence of the neural plexus within the wall of the colon, and hence there is loss of peristalsis. The affected segment becomes constricted. As you can see here, this yellowish colored is the neuronal plexus or ganglions. In this portion, as you can see, there is no neuronal plexus. This aganglionic segment appears constricted, and in the proximal ganglionic segment, there is intestinal dilation. This dilation is occurring due to excessive deposition of gastrointestinal contents. The outcome of Hirschprung disease is intestinal obstruction, resulting in constipation and vomiting. The mechanism of premature arrest of neural crust cells from migration and premature ganglionic deaths are not fully understood, but definitely there is a genetic component involved since the disease is more common in the first-degree relatives. In Hirschprung disease, rectum is always affected, and in most cases, rectum and sigmoid colon are affected together. In more severe cases, entire colon can also become aganglionic. The aganglionic segment appears normal or it is constricted, and there is no peristalsis in the aganglionic segment. The proximal ganglionic portion is dilated. As you can see here, this portion here is constricted, which means it is aganglionic, and the proximal portion of the colon, which is ganglionic, is dilated. This dilation is due to accumulation of gastrointestinal contents. The histological picture reveals aganglionic segment, and there is absence of both Meissner's and Auerbach's plexus in the intestinal wall. The ganglions can be identified by the immunohistochemical stain for acetylcholine. This immunohistochemical stain identifies acetylcholine in the biopsy. In case there is no acetylcholine detected, it means there is absence of ganglion or it is an aganglionic segment. The neonatal presentation is with the inability to pass meconium, and there is a consistent history of constipation. Moreover, abdomen is distended due to accumulation of gastrointestinal contents, and there is also a history of loss of appetite, nausea, and vomiting. Vomiting could be greenish in color due to presence of bile, or it can also be brownish in color due to presence of fecal content. The complications of Hirschprung disease include fluid and electrolyte imbalance. Enteric infections can also result due to obstruction, which can lead to intestinal perforation. Intestinal perforation constitutes an acute surgical emergency, which can result in profuse bleeding and peritonitis. Excessively increased accumulation of gastrointestinal contents in the ganglionic segment can result in increased dilation, resulting in toxic megacolon. The barium enema reveals a dilated section and a constricted section. As you can see here, this is a dilated section and this is a constricted portion of the colon. So which of these two is a ganglionic segment? Is it the dilated or is it the constricted one? The constricted portion is aganglionic, which means there is absence of neuronal plexus. And the dilated portion is ganglionic. The treatment of Hirschprung disease is surgical resection of aganglionic segment and anastomosing the two ganglionic portions together. So this brings us to the end of discussion about Hirschprung disease. If you have any questions, do let us know in the comment section. Thank you.